My name's Bailey.
My name's Emily.
My name's Hannah, and we're going to be doing a presentation over homelessness in the Upper Cumberland. And we have a little crossword puzzle for y'all to follow along with, just so you can get some key terms. And at the end, we'll have a key for you.
So, what is the definition of the term homeless? The definition of homeless is defined as having no home or permanent place of residence. Some other terms that would help to understand this topic are gentrification, which is replacing affordable housing with newer, expensive housing that members of the community are likely unable to afford. Unaccompanied youth are people under 25 years old without a parent or aren't a parent themselves. Unsheltered, those are people who live in cars, camos, and caves. Doubling up is living temporarily with friends or family. Panhandling is asking for money from people, typically outside of stores or on highway exit ramps or at red lights, stuff like that. Mission, homeless shelter, specifically Cookeville Rescue Mission, is in the Cookeville area near the movie theater. It is a religious organization. So practice question is, who makes up the majority of homeless individuals? A, accompanied men, B, accompanied men, C, unaccompanied women, and D, accompanied women. The answer is A, unaccompanied men.
Okay, for this first picture that we have, it is homeless population percentage in Tennessee compared to the rest of the United States. So the percentage is the percentage of the populations in each state that are homeless. So the really dark blue ones obviously have more percentage of the population that are homeless. And then the medium blue is like Tennessee, are in the middle, and then the lighter blue obviously have the least percentage of the population that are homeless. So like California and Texas have the most percentage of their population that are homeless. So for this slide, the total people suffering from chronic homelessness, so the people that are chronically homeless, that have been homeless for at least a year. So it looks like the same states are the ones who have the highest number of people who are chronically homeless. So Texas, Florida, and California have the most amount. It looks like Tennessee has 1,153 people who are chronically homeless. So this shows homelessness numbers in the Upper Cumberland area of Tennessee. So like Oak Ridge and surrounding counties. So this says that 258 people are homeless on a given night in this region, and 4.4 homeless people per 10,000 people in the general population. So this chart just breaks down the different subsets of homelessness within the Tennessee population. So this top dark blue line is just the total number of homeless people between 2007 and 2018. So in 2007, it was really high, around 11,000 people, but it looks like it's decreased in 2018 to around 8,000 people. This yellow line is just individuals who are homeless. In 2018, it looks like there's about 6,000 people. The unsheltered is this aqua colored line down here in the middle. It looks like it's down to about 3,000 in 2018. Homeless and families is the red line. Chronically homeless people is the white line. And then veterans is the dark blue line at the bottom. So it looks like there's been around 1,000, maybe a little bit closer to 2,000 homeless people who are veterans between 2007 to 2018. And then the little bitty line at the bottom that starts in 2016 is unaccompanied children and youth. So it looks like that is slightly increasing, a little bit less than 1,000. So this graph just shows where the Tennessee homeless population resides. So the dark blue half of the circle is people that are sheltered, just individual people who are sheltered. So looks like almost 3/4 of people who are on their own live in shelters. And then the this middle circle has people who are in families, and it looks like almost 3/4 of them live in a shelter. And then the rest of them are unsheltered.
So on this slide, we're going to talk about the rent in Cookeville compared from 2018 to 2022, just to give you kind of an idea of the expense of having a home and not being homeless. So in January 2018, the average rent for a 2-bedroom apartment was $625. So jump forward 2 years to January of 2022, and the rent for a 2-bedroom in average now is $897. So that's quite a large jump in the past 2 years, which it's already hard for people that are homeless to get on their feet and have enough for a monthly rent, a deposit. Usually you have to pay a first and last month's rent. So that's a lot of money with the $625 in 2018, but now with $897, that's a significant rise. So these are some statistics for Cookeville and then the state level as well as the national level. So the median household income in Cookeville is $29,901. So compared to the state level at $46,000 a year, we're significantly under, and then the national average salary is $55,000. So we're under in that aspect. And then for those that rent, their average income is $19,300 a year in the Cookeville area, whereas at the state level it's $28,937, so almost $29,000 a year. And then at the national level, the average renter makes $35,000 a year. So then at the bottom, I find this interesting with seeing where our income is less than the state and national level, but we are above the state and national level when it comes to poverty. So we're at 31.1% here in Cookeville compared to 15.1% at the national level. So we're almost double it is nationally. So in Cookeville, the average hourly rate that you're going to make, so this is an average of what everyone in Cookeville makes, which we have a lot of employment opportunities with. There's several factories, Walmart, Academy, the hospital, lots of restaurants and fast food. So this is a accumulation of all of those professions. The average is $14.83. So using that information, what person in Cookeville could afford an $895 a month apartment? So we're going to assume this person works 40-hour weeks and that they work 50 weeks of the year. And they must not spend more than 1/3 of their income on rent. So that way they can save their money. They have money in case of a medical emergency. They can pay their utilities. They can afford food. So our options are $14.83 an hour as a nurse assistant at the local hospital, $18.40 an hour as an LPN at a doctor's office, $16.23 an hour as a shift manager at Buc-ee's gas station, or $10.33 an hour as a shift leader at Burger King. So out of all of those options, the person would need to make $18.40 an hour as an LPN. So this is the only person whose income would be enough to pay this $8.95 a month without spending more than a third of their income on rent. So if you add that up, their yearly income would be almost $37,000 a year. So for the person to afford an average 2-bedroom apartment in Cookeville alone, they would need a yearly salary of almost $37,000 to not spend more than a third of their income on rent. And on that chart we looked at previously, I don't know if you guys remember what the average renter's income was in Cookeville, but it was $19,300 a year. So that is a significant drop compared to what you would need to make to be financially stable and not be using all of your money on rent. So this little exercise, just talking through like the incomes, the rent costs, it explains how the solution to helping people in homelessness is a lot more complex than just telling them, oh, Burger King's hiring down the road from where you're sitting and panhandling. It's a lot more complex than them just going and getting a job. So some local laws that have been or have attempted to have been passed. The city council, they had to vote on an ordinance where they were talking about fining people that were sitting on like the exit ramps or patrolling like Walmart, Academy, stuff like that with signs asking for money. They were planning on handing out fines to those people, but it ended up not passing, and the city opted to post these signs that you see on the PowerPoint that say no to panhandling, contribute to the solution, give to charities. So they recommend you donate to like the soup kitchens, the recovery places, Genesis House, the Cookeville Rescue Mission, places like that, instead of putting money into the hands of these people and you not knowing where they're spending it. So some more laws that we are going to talk about regarding homelessness. These are at the state and federal level. So Tennessee Senate Bill 2867 discusses the need for additional monitoring of the homeless population to better assist them. So I guess that's just saying the more data that you have on a population, the more you will be able to help them because you know more about them. Another Tennessee Senate Bill 1844, it grants protection to those organizations that we've talked about that assist this population, like the Cookeville Rescue Mission, soup kitchens, Genesis House. So it keeps them from being held liable in the event of an accident, as long as they were not being negligent on their end. So it just grants them immunity from getting into legal trouble because they're going out and helping these people. At the federal level, we have U.S. Senate Bill 2182. It discusses the need for a federal database of those who have been evicted or who are facing eviction to help them get assistance and to prevent the eviction. So they figured out that preventing people from getting evicted is a lot cheaper and easier than helping them after they've been evicted. And keeping them in the home keeps them from being homeless again. And then once you're evicted, you have to think about things like people aren't going to want to rent to you because you have a bad rental history. You're going to have to pay another deposit and then a first and last month's rent to be able to move in. And with the way the housing market is right now, finding any apartment is hard. So this is just to avoid those issues. And then U.S. House Bill 1856 declared a state of emergency in 2019, which there were certain communities that were having a high number of homeless people, and this was around the time COVID was getting started too, so I think it pertains to that. People were losing their jobs, not being able to afford rent, and the homeless numbers were just increasing. So they declared a state of emergency to get some rental assistance programs in to give money and grants to those that had the biggest need.
So what resources do we have in the Cookeville community that helps this population? These are just some of the popular ones here. The Genesis House, it helps aid women who may be struggling with abusive relationships or who are also homeless. The Cookeville Rescue Mission, it is a faith-based shelter. It's open to men, women, and families. They do have a lot of rules and restrictions that they want you to follow, such as sobriety and attending various religious gatherings if you're going to be staying there. And then we also have a recovery kitchen. It's a soup kitchen that's run out of a local woman's home. And she has also struggled with homelessness herself in the past. And now she's giving back by giving food out to this population.
So for Caring Works describes homelessness, says that it impacts the availability of healthcare resources, crime and safety, the workforce, and the use of tax dollars. Caring Works' mission statement is to reduce homelessness and empower the marginalized by providing access to housing and services that foster dignity, self-sufficiency, and well-being. Caring Works has proposed a solution that would require their residents to work, pay taxes, rent apartments, purchase groceries, volunteer, and join faith-based organizations. And in all of this, learn to be good neighbors and to be good friends. In 2012, Sean Donovan, the Secretary of the U.S. Housing and Urban Development Department, stated that between shelters and emergency rooms and jails, it costs about $40,000 a year for a homeless person to be on the streets. So if we were to just include jail, that would bring it down to $21,000. What Caring Works proposes is that with their method, we can get it down to $13,725 per year. Caring Works' ultimate goal is to make these people become self-sufficient, and then there will be no burden of cost on anyone. Programs such as Caring Works help break the cycle of homelessness by providing services that include, but are not limited to, housing, mental and physical care, treatments for addiction, health and finance education, and job search guidance. Like I said, using Caring Works' proposed methodology, helping the homeless get on their feet and become productive members of society, they predict that the annual cost of per homeless person will decrease to $13,725. And with that, the population of homeless people will turn into a group of self-sufficient individuals, no longer creating any financial burden.
Healthy People 2030. So it listed in the objectives of Healthy People 2030. It has listed a lot of populations, so women, men, adolescents, older adults, people that are in the workforce, people that have disabilities, LGBT, but it doesn't list homeless people as an individual entity on its page. It does, however, list just like a brief statement that could help decrease homelessness, but it doesn't just come out and say homelessness as a population in its objectives. A lot of the populations can be represented within the homeless population, but it just doesn't have any core objectives to help this population in general. So the statement says that some people also struggle to pay for their homes. This is linked to worse mental health and increased risk of disease. Policies that make housing more affordable can help health and reduce the risk of homelessness. So this statement kind of implies that one way that we can decrease the incidence of homelessness is to make housing more affordable. And that would be a good idea, and it could help significantly, but Seeing as we showed you how much the rent has went up and how much housing has went up over the past couple of years, that would be very hard to do in general for everyone. So one way that we could do this is to make housing, like income-based housing, just for this population to help them get an actual place of residence. Another example that is listed in Objective Healthy People 2030 is to lower the cost of healthcare, improve insurance coverage, and increase the use of telehealth in healthcare. So what resources are needed for the homeless community? Medical services are needed vastly for homeless people because most of them use the ER as their primary medical care. So places like that are clinics that are based on a sliding scale pay. So based on how much you make is how much you would pay for your visit, or places that are set up just for people who don't have insurance or can't afford medications or transportation. Something like that would be the best thing for the community. More shelters. We had talked to a few homeless people in the community, and they would like shelters that are not religious based. All that here is in the Cookeville community is religious based, and they don't accept all people, especially those that are not religious. So this would help be open to everyone, and anyone would be able to join. And affordable housing, like I spoke about on the last slide, getting income-based housing or just more shelters in general for people to stay until they can get on their feet and make some money and save up money for another place. And then the last one is community leaders. It's important to elect community leaders that can help get funding for all of these resources that would be needed in the community. So how can we get these resources? Get involved in local elections and elect leaders that want to help the homeless community. So by electing in officials that would do this, they would get more government funding, more grants and stuff, so that we would be able to establish those resources that I listed on the last slide. Nonprofit organizations and government funding to open more housing and shelters that are affordable and are open to everyone and not just those of a religious faith. Medical services specific to those of the homeless population, provided transportation, so transportation for those medical places that would go and pick the individuals up and take them back without cost. Medications that are of no cost or at least affordable, maybe based on your income, and telehealth options. So if those individuals are able to get access to a computer or a phone, maybe they could get healthcare services over telehealth. That way they didn't actually have to come in and see anyone. And here are references. And we have a key to the crossword puzzle, and we will upload 2 links for the crossword puzzle and the key to it.